Hello, I'm Dr. Brian Wong, founder and CEO of the Bedside Trust. In this podcast, I'd like to talk about the 3 tenets of patient-driven leadership. It's really a good thing that there's only 3 tenets because as a family physician, typically I can only remember 3 things at once. Patient-driven leadership, of course, is based on the core belief that what matters most to patients determines how we practice as leaders. So it stands that tenet number 1 is begin with what matters most. Begin with what matters most to patients. And let's think of patients not in that third person, them, those nameless masses of people who come in to see us. Let's think of patients in the first person. It could be me. Or in the second person. It could be my mother or somebody I care about very much. And when they're sick and they call us, and sometimes we're too close to it to fully grasp or understand what's going on, we find ourselves in the same position as they are, scared and vulnerable. And as we are about to approach our patient care team for the very first time, what matters most to us is not the technology, it's not the service line, it's not the facility, it's not the electronic medical record. It's about the human condition and the human connection. Are they listening to me? Are they respecting me? Are they regarding me? Are they taking the time to pay attention to me? Am I the priority? Are they communicating with me? Are they working together as a team? Are they showing compassion? Do they seem like they care? Those are the things that matter most. And when we think about our daily interactions and relationships with each other as healthcare professionals, that's also what matters most to us. So if we focus on what matters most to patients, by extension, we'll be focusing on what matters most to us. And as leaders in healthcare, it's our responsibility to create the conditions that allow our people to focus on what matters most to our patients, and by extension, therefore, what matters most to all of us. Tenet number 2 is let's understand the important difference and distinction between the many unique jobs we all do and the one role we must play as patient-driven leaders. This takes us back to the trusted acronym, 7 letters, TRUSTED, teamwork, responsiveness and respect, understanding without judgment, safe conditions, being approachable and inviting. In addition, being talented, executing to get the best results, and having a work ethic that demonstrates your dedication. TRUSTED. Now, the distinction between role and job is really the distinction between the top 4 letters, T, R, U, and S, and the bottom 3 letters, T, E, and D. In all of our unique jobs, whether we are a physician or a nurse or a unit coordinator or a housekeeper or somebody who works in food services, chaplain, social worker, executive, facilities, etc., we all have a different job that we do. And in those jobs, we're expected to be talented, to execute, and to have the proper work ethic. TRUS, on the other hand, is the one role we must all play if we are to be patient-driven leaders focusing on what matters most. In other words, everybody in the organization, beginning with the CEO, extending to the executive team, including the board of trustees, including all physicians, most notably the physician leaders, nursing leaders, managers, must accept as their role teamwork, responsiveness and respect, understanding without judgment, and creating safe conditions for conversations to occur, even when we know there's going to be disagreement. That is our universal role for everybody in a healthcare organization from bedside to boardroom. When we do that, when we understand our role and have role clarity, we are in fact providing what matters most. So tenet 1 and 2 are inextricably linked. Tenet number 3 is let's understand how to create patient-centered relationships. In other words, the better we get at focusing on what matters most and maintaining role clarity helps us to form stronger, healthier, more effective, more productive, high-performing relationships with each other, especially when that is modeled and developed and cultivated at the leadership level of an organization. So if you are the CEO, think of forming patient-centered relationships with the key people you work with every day: your board chair, your CFO, your COO, your chief nursing officer, your chief medical officer, your chief of staff. If you build those relationships, which are your most important daily leadership relationships, and focus on becoming a patient-centered relationship, you are then bringing into full focus all three tenets: focusing on what matters most, understanding your role as distinct from your job, and then forming one-to-one relationships at a leadership level that then trickle down to your board of trustees, to your executive team, to your medical executive committee, to your nursing leadership council, to your management group, and so on down to the front line. Those are the three tenets of patient-driven leadership: what matters most, role trumps job, patient-centered relationships. When those three elements are in place, you create an environment where you can begin to build patient-centered problem-solving teams that begin at the highest levels of an organization. And then and only then does it have an opportunity and a chance to trickle down all the way to your clinicians, to your physicians, to your nurses, and everybody in the healthcare organization, literally from bedside to boardroom. Thank you.